As you can see, the video's been recorded on the same day. I'm wearing a different hat. I'm having real bad hair. Um, the fine ones are getting pulled out by barrettes and they're tickling my nose and eyes and cheeks. And I went for a haircut and didn't stop it, so now I have to wear a hat because I can't find a headband. And I have to wait till the end of the month till I can afford to go to the dollar store and get headbands. Anywho, I felt compelled to do another video today because of bad news that I got yesterday. So I wanted to do the video while it was still kind of fresh. Yesterday I went to see my pain clinician. I also deal with chronic pain. So on top of the chronic lifetime major depressive disorder dash treatment resistant with ideation. I also suffer from chronic lower back pain. And yesterday, the pain specialist told me that there was nothing that he could do for my back. And I'm saying, like, I use a walker. I have to. Every step I take is painful. And I've been dealing with this since my last surgery 2 years ago. I have scoliosis, and my first operation was when I was 13 years old. And I've had several since then, but the last two really put me down physically. And because of suffering from CLMDD, I wasn't moving a lot to begin with. So over the years, I lost muscle mass, and my muscles aren't strong enough to, let's say, if I fall, I cannot lift myself up. I can't even contort myself somehow to use my walker and all that. I just cannot do it. My muscles in my legs are not strong enough. I mean, sure, I'm overweight, but who isn't? I should be able to pick myself up. And for me, it's a safety issue if I'm out in the winter and I have to use the walker. There's no choice. There's more of a chance for me to slip and fall, and I need to pick myself up because at the moment I stand alone. I do not have companionship per se from a friend. Let's say a friend, the type of friend that comes over and drinks coffee and chit chat about everything. And so I don't have that. So it's very difficult because everywhere I go by myself. So I need to take care of this. In the conclusion, I was going into the appointment thinking I would be getting a caudal injection. Feel free to YouTube that. There's a couple videos on it. Of course, I do my homework all the time. So I checked them out. It looks scary. It was something I was not looking forward to having done, but I would have, I would have asked to be put to sleep. That option is there because my anxiety just was through the roof, thinking I would have this procedure done. And what it does is it injects steroids and is supposed to lower the back pain. But my pain clinician and my pain RPN reviewed my x-rays in that area, the lower back area, and concluded that there was no room to insert a needle close enough to the problem area. So, in other words, it wouldn't even touch the painful area because there's so much hardware and bone that they can't get in between that to inject anything. And if they were to inject steroid, let's say, outside of that, it wouldn't fix that problem. It's not like steroid will seep in, you know. So basically, that's what I got, was there's nothing we can do. So of course, we discussed, I thought it was a nerve problem, but it's not a nerve problem. He checked my MRIs and said that all the nerves look healthy and fine. But what it turns out to be is just physiotherapy. That is what I need. Physiotherapy. To build back my muscles. And I mean muscles in my whole body. Because of the long recovery concerning the back fusion, I became even more sedentary than I was when I was, suffering from CLMDD. And I've been on the list for physiotherapy at one of my local hospitals. Stupid little hairs. For quite some time. I mean, I know things take time, but is it just that there's one physiotherapist or what? See, these are the things that, I need to find out. Why is it such a wait? Is it because there's not enough staff? Is it, what is it? Like, I mean, in the summer, you'd expect to wait because people are taking vacations, but we're past that now. We're October 20th, 2023. So anyway, I told my clinician that I wanted to be referred to a different physiotherapy hospital, not the one that I have been referred to and in line for I don't even know how long. The other physiotherapy program I've participated in when I was an inpatient on the mood disorder unit, and I did some sessions, and I also did some sessions in the pool. They have a saltwater pool, and their lab, physiotherapy lab, is state of the art, and that's where I need to go. My whole left side, where my ribs, and I have no muscle. My pain RPN told me I have no muscle, and I have flaps, and I thought they were like from fat rolls, but they're indeed skin flaps because there's no muscle to fill this area out. I'm talking about this area right here. So those flaps are actually skin flaps. And once my muscle in my back is rebuilt, this should disappear. Everything takes time. So my pain RPN, I have an in-person appointment with her on November 3rd. And so we're October, what did I say again? October 20th. So, I mean, it's still a long time away. When you've been dealing with an issue for so long, it's like, how much longer? I say that with understanding that there are reasons for it. Um, you know, before ketamine, I would have taken something like this very personally. Why would, you know, do they not want to treat me? Am I not being believed about my pain and about all this? Am I a drug seeker? And those things I would think about before ketamine. But now, um, I think about it a lot more differently. You know, I accept that it takes time for these things to happen. Um, and that as long as I put myself where I'm supposed to be, um, I will benefit from that. So, dealing with bad news, when I got the news, my hospital is downtown. So I just went downtown and I walked around. And I walked around the waterfront and, you know, I always have to work, even though ketamine is working. It doesn't change things. I mean, it changes your mood, yes. But, you know, your mood has changed, therefore, you're able to, well, I'm sorry, I'm able to, you know, think about things in a more rational sense and logical sense. And patience. I'm able to do that without having all the other dark things come along with it. So I went downtown and worked on it. You know, worked on the bad news. I consider it bad news because there was nothing he could do. So now the only thing left is physiotherapy, and I need it badly, and I need to go somewhere I trust, and I have verbalized that to them. So, yeah, that's how I dealt with my bad news. Is I rationalized it and put it in a logical way of understanding it. But the cherry on top of the cake is not having all that um, dark thinking that goes along with it. I'm good with how I am, how I process the bad news. I mean, I'm good with it. As long as I have physiotherapy to look forward to, I'll be okay concerning this issue. It can't come fast enough, but like I said, I realize that things behind the scenes. We don't see things behind the scenes. So, and it's out of my control, so there's nothing more for me to do but wait. Wait and make sure when I have my appointments that I voice the things that I want done. And not in a rude way, of course, you know, in a respectful manner. So that was the processing journey, I guess, of receiving bad news. How I used to deal with receiving bad news, and how I deal with receiving bad news. While I receive ketamine as a treatment. So that'll be it for now. As always, I really want to know how you guys handle bad news. You know, maybe there's some way we can support each other and try to, yeah, support each other with bad news, how we deal with it, and, pre-ketamine and post-ketamine. I always want to hear those stories. So I'll leave you for now. And might be another hat change. I don't know. But I have to wear one because of those stupid little angel hairs, I call them. Okay.